Now this is the CT angiogram. This will be a bit lengthy, but you have to be with me patiently. This is the celiac trunk here, this one. In fact, all the blood vessels, they are mildly narrowed at their origins, whether it is a celiac trunk or rest of the blood vessels. This is the superior mesenteric artery. These are the renal vessels. This is abdominal aorta. You can find the atheromatous plaques. Let me magnify it a bit. Now this is the aorta which continues downwards. This is the graft here. This one is the bypass grafting which was done previously. In fact, the patient came from far off and didn't have any previous records of any previous surgery or whatsoever, because multiple treatments have been done with this patient, percutaneous stenting and the operative as well. Now you see, this is the aorta. This is the graft which is anterior. First I will show you its normal course of the aorta. I come down. This is the left common iliac artery. You see the atheromatous plaques. This white is the patent lumen, while this is the calcification and this is the atheromatous plaques. This is the right common iliac artery, and this is the calcified plaque. This is the patent lumen. Now first I will show you the right side. Now there are variable degrees of narrowing from moderate to varying from the moderate to severe degrees of luminal narrowing of the right common iliac artery. Now this is the right external iliac artery. You see again variable degrees of from moderate to severe luminal narrowings of the right external iliac artery. Now I go back to the left common iliac artery. This is left common iliac artery. You find this is the atheromatous plaque calcified. This is the patent lumen. You see, so moderate to severe luminal narrowings. At places it comes again to life, and for example at this level it's hardly perceptible, just a very thin thread like left. Now this is completely thrombosed here. This is left common iliac artery. I go back again. This was completely thrombosed from this level downwards. This is left external iliac artery. This is the external iliac vein here, and this is the graft. Now I go back to trace the graft. Graft originates from this place. We come down. This is also partly thrombosed. This area is thrombosed. This is patent. We come down. This area is thrombosed. This is patent. Now it divides into two. This is completely thrombosed. Left branch is patent. If we trace it down, it joins the left superficial femoral artery here. Now first I will follow the left superficial femoral artery. This is left superficial femoral artery. Above were the profunda femoris artery and its branches. These are the profunda femoris artery and its branches. They are also severely narrowed. Now I come down. This is in the adductor canal, distal part of the lower part of the adductor canal, and now it is the popliteal here. You see it is moderately narrowed here. I come down. This one is the popliteal artery. Now this is the origin of the anterior tibial artery. but anterior tibial artery is patent at its origin, and lower down it is completely thrombosed. This is the course of the anterior tibial artery. This is the anterior tibial artery. There is no blood flow in the anterior tibial artery and the dorsal spurious artery. I come down. Now I go back again. This is the posterior tibial artery. This is the popliteal artery. I'm tracing it down. This was the site of origin of the anterior tibial artery. This is tibio-peroneal trunk here. Now you see posterior tibial artery is completely thrombosed. This is the peroneal artery. This one is the peroneal artery. Posterior tibial artery should go somewhere here. This is the peroneal artery. Just follow it. This courses down. This is the peroneal artery. This one is the peroneal artery here. This courses down along the posterior surface of the interosseous membrane. You see it's quite low down here. Now it will turn medially and will follow the course of the posterior tibial artery posterior to the medial malleolus here. You see this white line here? It comes into the sole and divides into two branches, medial and the lateral plantar branches. This is lateral branch, this is medial branch. These constitute the plantar arch, and you see these are the distal branches. These one are the distal branches, and these perfuse the distal branches of the dorsal spurious artery as well. Now we come on to the right side. Now this is the right femoral. You just follow it. This is the site of division. It is completely thrombosed. This is the profunda femoris artery. This one is the profunda femoris and its branches. Its lumen is relatively good as compared to the left one. Now this is the superficial femoral artery. It is completely thrombosed. This is the stent. Now the central part of the stent is black. That means it is completely thrombosed. If it was patent, then this also must contain the contrast medium, and this should have been white. But now at the lower end of the stent, again superficial femoral artery in the distal part of the adductor canal opacifies. This is the superficial femoral vein. This is superficial femoral artery in the distal part. Again, obviously there are narrowings here, and this is the calcified atheromatous plaques. This is the popliteal artery. Just now follow this as well. Popliteal artery here. This is the site of origin of the anterior tibial artery. This is anterior tibial artery. Only few centimeters of anterior tibial artery are patent, and low down, I'll show you hurriedly, it is thrombosed. It should have been white like this here in this region. Similarly, dorsal spurious artery is completely thrombosed. Now I go back. Distal to the origin of this is tibio-peroneal trunk. Posterior tibial artery is thrombosed in this case as well. It should have originated somewhere here and traveled this way. Here again, peroneal artery is patent. It courses fairly good lumen, just like the left one. You see, the posterior tibial artery should have been somewhere here. Here again it courses medially, just like the one that we saw on the left side. This is the medial, this is the lower end of the tibia, medial malleolus, where normally we should be seeing the posterior tibial artery. This in fact is the downward continuation of the peroneal artery which courses medially and takes the path of the, or maybe that upper part of the, since upper part of the posterior tibial arteries are occluded in both the legs, but lower parts are patent, so this deviates medially and it perfuses the distal part of the posterior tibial artery. In the foot, again you find that both the branches are patent and the distal branches in the plantar arch are also patent. So lesson to be learned is that at times posterior to the medial malleolus we may find that the posterior tibial artery is patent, but in fact it is the continuation of the peroneal artery. So we must see the proximal part of the posterior tibial artery as well on Doppler examinations. It should be somewhere here. It should be somewhere here. This is the course of the posterior tibial artery. But obviously, since there are proximal, moderate to severe luminal narrowings on either side, and the vessels obviously are blocked, the superficial femoral artery on right side and the external iliac on left side. So on Doppler examinations, there will be low velocity Parvus Tardis type of blood flow in these blood vessels. But obviously, we cannot trace these blood vessels as good, as effectively as we are seeing on the CT angiogram. Now, this is the CT angiogram. I'll show you. This is the 3D image of the, now this was the graft here. If its left side was patent, right side was blocked here. This is the native aorta. This is the left common iliac artery. This is the right common iliac artery, and you see these atheromatous plaques and the degrees of luminal narrowing. From this place onwards, there is no opacification of the left external iliac artery, while on right side this is patent, but this graft, part of the graft, is patent on this side. Now this is the part in the superficial femoral artery. Left one is the patent. This is completely occluded onwards from this place downwards. This was the graft here, and the, as I've said before previously, that this part of the superficial femoral artery is patent. So each of these blood vessels has to be documented and reported upon separately. We just cannot sum up in the single report. Now this is the distal part here. This in fact is the peroneal artery which continues downwards. It is good. And then it courses medially and takes the course of the posterior tibial artery. These are the plantar branches. I'm sorry, this is a long video, but I just wanted to show you the graph and the extent and how to report this, such cases.